Good evening, everyone. My name is Regina Brown Wilson, and I will be the moderator for today's community conversation, where we will discuss the impact of COVID-19 on kids and youth mental health and wellness. This conversation is being presented by Vaccinate All 58 and California Black Media. We know that the pandemic has been hard on everyone, both young and old, and before we get started, we want to encourage everyone to be inspired and remember to protect yourselves and the community from COVID-19 and its fast spreading variants by getting vaccinated and boosted. Through the pandemic, the state's COVID-19 awareness campaign has executed community conversation comprised of medical experts, community advocates, education administrators, and personal testimonies to provide updates, vital information, and a forum for discussion. Earlier this month, we recognized Children's Mental Health Awareness Week. We want to continue to bring attention to this important topic because our children are wrestling with emotional issues and the deep need on how to navigate and deal with these issues. Before the COVID-19 pandemic, mental health challenges were the leading cause of disability and poor life outcomes in young people. With 1 in 5 children ages 3 to 17 in the US having a mental health issue, and developmental or behavior disorder. The pandemic has only added to pre-existing challenges that America's youth face by disrupting the lives of our children and adolescents. Today, we want to dig deeper on this issue of mental health, our youth and our children, offer useful information that will help support them. And today I'm so excited because I am joined with a panel of wonderful professionals on the front lines on this subject matter. Dr. Donna White Carey is a pediatrician and director of the Case Disease Management for Alameda Alliance for Health. Charles Walker, as well as I'm so sorry, but I want to call her a Dr. Jewel. I'm manifesting that you will be a doctor very soon, but Jewel Forbes, project director of the Community Health and Safe Schools and county lead for school counseling and violence prevention. So before we jump into the conversation, I just kind of want to talk briefly about their backgrounds because Dr. Donna White is a pediatrician and is affectionately known as Dr. Donna. She is devoted to revolutionizing the way we view health. Her mission is to build a generational of health network by promoting 4 pillars of health: emotional, mental, spiritual, and physical, and environmental health to end the cycle of premature death in the Black communities across America and the diaspora. Dr. Donna is an executive producer and host of a YouTube channel, Talking with Dr. Donna, a show created to promote accurate health information about COVID-19 and other health conditions that impact the Black community. So welcome and thank you for being here. Charles Walker is a licensed clinical therapist with a master's degree in social work from USC. He has 7 years of overall therapeutic experience and recently started his private practice where he has been focusing on building his brand and helping his clients become the best versions of themselves, which is what I always love. Charles is a member of the Omega Psi Phi fraternity and enjoys mentoring, which we all need. Jewel Forbes, who I'm already manifesting is going to be a doctor soon. In our next conversation, she's just going to be a doctor, is a student service and education. She worked in student services and education for over 25 years and is currently the project director #2 for the Los Angeles County Office of Education, Division of Student Support Services. In her role at LACO, Jewel serves as a lead for school counseling, school-based mental health, and violence prevention to the 80 schools within the district. As a part of the Community Health and Safe Schools unit, Jewel serves as a co-chair for the following countywide committees: the Los Angeles County Suicide Prevention in Schools Work Group, and the Los Angeles County Network Against Hate Crimes in LA versus Hate in School Work Group, which I think all of us know a little bit about, and I think all of our communities have been reeling, obviously, from the weekend of getting that devastating news of what happened in Buffalo. And I think that this conversation is so on point right now. We need it because our kids are seeing this. We're coming out of a pandemic and we're trying to figure out how to work with each other now. And so, I just want to start our conversation and kind of get this where we can feel comfortable together and make the audience feel like they won't be able to chime in and ask questions, but maybe they'll put them in the chat and you'll come back and respond to them at some point. But just to get us into a place where we're able to, make people feel comfortable and hopefully solve some people's problems that they may have or questions that they might have around mental health. So, let's just kick this off. What do you think is the link between COVID-19 and mental health? And Dr. Donna, let's go ahead and start with you on that, because you're just nodding your head like like I could tell you.
No, I was saying that's a good question. So first, let me say, Mr. Charles, I went to UCLA, so but we're going to be amicable tonight, okay?
We will be civil.
So the link between, well, can I say something before I answer that question? Because I do want to start by saying that we are not out of this pandemic yet. The pandemic has moved to a different phase, but it is not by any means over. And so particularly for our community, the African-American community and other communities of color, we are continuing to be hit hard by this virus. We're continuing to see cases rise, people being hospitalized, and people still dying from this disease. So we're not out of the woods. So I really want to just encourage you and just to echo what Ms. Regina said about continuing to get a vaccine. If you haven't had your primary series, we could talk about that a little later, but get that vaccine, get that booster. And I'm going to say, let's go back to like the California Department of Public Health, and all public health departments are strongly recommending to wear a mask. And I'm saying that for our community, that is not a recommendation. That should be a requirement. We should be wearing our masks indoors. And if you're outdoors and not eating, you should be having your mask on. Now, that is, in my opinion, the best way to help to stop this phase of the pandemic that we're in. So
can I just
wanted
say
to start with that?
That my daughter must have been getting that message from you, because I said I was keeping my mask off when I'm outside. So now I'm going to tell her, my 11-year-old, that she's right. Dr. Donna said,
that's right.
My mask on even when I'm outside. Okay.
It's the safest. It really is the safest. Now, to answer your question about the link between mental health and COVID, we know that in this pandemic, there was just a complete shutdown of normal life. And that shutdown happened for everyone across all ages, races, and every ethnic and cultural group. But what was particularly impactful for children is that this is the time when they are the most social, right? They're going to school, they're learning in classrooms, learning face to face, they're learning social cues, how to interact with each other, how to navigate life and negotiate circumstances, right? Like who sits in the front, who sits in the back, how do I, play this game? How do I not foul you on the basketball court? Like these are all of the things that they're trying, that they should be learning. And that was taken away. And it was taken away without a lot of guidance and without a lot of knowledge about how do we replace it once we are sort of away from one another. So I think just the short answer, because I know that Ms. Jewel and Mr. Charles have answers as well. I just want to say that the impact of mental health and COVID is that it really packed on additional issues around mental health that were already increasing prior to the pandemic. And then with the start of the pandemic, it exacerbated some, made it worse. and caused other kids who may not have had mental health issues to now have mental health issues. There isn't a child that I have come into contact with post-pandemic that hasn't had some bout of anxiety, depression, social anxiety that has not been, their mental health has not been impacted by the pandemic. So when we're talking about children impacted, it's not just some. I'm going to say that probably all of our children, some to a lesser degree, some to a more degree, their mental health has been impacted by this pandemic.
Mm. So then that leaves me to, to get some of our other panelists' thoughts on this. And you're saying this, you're seeing this from a pediatrician. It's probably getting people from a cold or a sniffle. So, Mr. Walker, how are you seeing it? How do you see this playing out? Are you getting a higher number of people who are, utilizing your services related to, the pandemic?
Absolutely. I want to say that Dr. Don really hit it right on the nail as it pertains to our kids. I mean, even if we look at the life stages of development, we're looking at Erickson's, and we're looking at the school years. She hit it right on the nail. Like this is the time period when kids are supposed to be in school. They're trying their best to achieve and not, they're trying to be the best version of themselves in school. And when that was taken away from them, sometimes it can lead to shame or inferiority. And even with our adolescents, which is the ages of identity versus role confusion. Now, this is the time when kids are trying to find out who they are as a person, or within their own social network. And by them being stuck at home, it really put a pause on their development. I remember in LA County, a teacher once said, like, "Oh, I'm only required to do only 1 hour or hour and a half a day. So you're trying to tell me in school, when you're at school for 8 hours, you're only telling me that now you're only required to do an hour and a half of teaching a day?" So not only were their mental health affected, but academically they were affected. But just even with that, I've had clients who were 17 years old when the pandemic happened, and now they graduated. They didn't have a graduation. Now they're in college, and they still can't go into the classrooms because of the pandemic. And it really hurt. Some people who were once social weren't no longer social. I currently, not only do I work for my private practice, but I also work at a psych hospital. So I saw an increase of admissions for 5150s, people who are having suicidal thoughts, ideations, and so forth. And they were all younger, 18, 19 years old. They were having a sense of not being able to, they didn't recognize themselves, and they were becoming depressed. DCFS reported it was an increase in child abuse during the pandemic. It was an increase in alcohol. I can tell you one thing: the liquor stores didn't close.
Well, and I believe they set it up where you could deliver too.
The stock, what you call it, the liquor stores, their stock increased because people were buying more and more drinks and bottles. More child abuse. There's more domestic violence due to the pandemic, and all these things have led to exacerbated mental health issues. So I do get a lot of people coming into me regarding, depression, anxiety, work stress, having to go back to work, and so forth.
Well, that leads me to Jewel. You're seeing this. Not that you guys are not on the front line, but she is a person who's probably sending them to you. So I know that you are in the school system, that you are probably seeing it first, and then they get referred to the pediatrician or to the psychologist to help them, the therapist to help them navigate through whatever mental issues they're having. So how do you see the link playing out from where, you work?
Well, it's interesting to, first of all, we are not through this yet. And I know, we realize that. But one of the things that hits home the most is that we're just beginning to see the ramifications on students' mental health. But let's talk about, during the pandemic. So during the pandemic, we saw like a huge increase in mental health needs of youth. But one of the issues was because everything was shut down, access to mental health was difficult. So, there were certain places that were providing telehealth services, but that wasn't available to all students. So what we were hearing was school staff were contacting us, trying to navigate during the pandemic. But because things were closed, you had families actually showing up to emergency rooms with their children because they needed help because they were in mental health crises. Well, that was, dangerous because we also had people who were COVID positive showing up at the same emergency rooms. So that posed a lot of risky behavior, a lot of chances for students to get sick. And so early on, we began to really talk about how can we provide mental health during the pandemic? And so we met with a lot of our local partners to really address the situation by expanding partnerships. I know Mr. Walker was talking about, child abuse cases. Well, here is what we dealt with. We saw a drop in child abuse cases through the hotline. Now, does that mean that child abuse stopped? No. The problem was that youth were no longer in school. They were at home, oftentimes with the same people who were abusing them. So that's why we saw this huge, decrease in child abuse reports, but child abuse, as you said, was actually increasing. And so we were able to expand telehealth services through the Department of Mental Health and other agencies, but for many youth, they just did not have access. We began to work with Parks and Rec to provide safe spaces where students could sign on to actually have interaction with a therapist. But when you think about youth of color, especially Black youth, access was very limited. And our youth were actually some of the ones that were experiencing the most severe needs around mental health. We still continue to see high levels of depression and anxiety throughout our schools at every level. And, it used to be a time when you saw more mental health issues in the high school. It's starting to change. We're seeing the same thing in the elementary schools. We had children that were crying uncontrollably. We had children who couldn't sleep. They weren't eating. All their patterns were shifted. And so we knew we had to address these needs, in the best way possible. And that is by collaborating with other community agencies to try to get services to youth.
Well, wow. So, Charles, this probably kind of leads to some of the other things that we've seen in the news, where the CDC recently published a study citing a disturbing increase in suicide attempts. And how can parents recognize that their child may need help? Like, what are some of the signs that we should look at before, we see some of these things where someone feels that they have no other option but to take their own life?
Well, I will say that, parents have to continue to stay present with their kid. When your child starts doing stuff outside of the norm or the routines, they start no longer being able to express themselves, or they may start, isolating more. Or let's just say if your child is like 8, 9 years old and still wetting the bed, either it could be something medically wrong, which sometimes, but studies have shown that that's a sign of sexual abuse.
Oh, wow. So
just being able to look at some of these cues, whether it's that, whether it's isolation, whether it's, or having like anger outbursts. Sometimes, let's be honest, in the Black community, even in the brown communities, Black men, boys, we're taught to not express ourselves. We tend to internalize things. But, when it comes to internalization, it's kind of like putting trash in the trash bag. Even when you're in the kitchen, you're putting trash in the trash bag, eventually the trash gets full. Mm-hmm. But sometimes kids don't have an outlet to express themselves. So if they continue to internalize, more stuff is getting put into that trash bag. Now, eventually it's going to overflow. And how that relates to human behavior is we'll have a tendency to lash out. We'll have a tendency to isolate more. We'll have a tendency to say, you know what, I don't want, having suicidal thoughts because now they have no outlet. They didn't have anyone to speak to. So some of the signs to look, some of the signs to look for is when your kid is feeling hopeless. Maybe the eating patterns have shifted. Maybe crying spells, or just, and I would recommend just to the parents just to try to understand what your child is experiencing. Listen carefully. Sometimes as parents, we tend to like brush things off, or tell, or in the Black and brown communities, we don't even believe a lot in mental health. We want to say, oh, give it to God, we'll pray.
Okay, can you not be selling my stories? Because that is me. I've said it to my daughter that, I'm like, I keep thinking that I can do it through prayer, and I think it's probably worked for me. But I also know that I've had my oldest daughter who said, Mom, you really still need to see a therapist. So
think about it like this. Since you are spiritual, God uses people as vessels. So essentially, a therapist can be that vessel that he uses to help another person. So yes, I believe in the higher power, but we have to get out of the tendency of just saying, just pray about it. It will be okay, because a lot of us are dealing with generational traumas.
Right.
It's done to our parents, we're doing it to our kids because it was done to them and their moms and so forth.
And so,
and we fail to recognize, we tend to not identify that. Sometimes it takes a professional to kind of psychoeducate the parents as well as the child what they may be experiencing.
Yeah.
So Dr. Donna, are you seeing that? Like, obviously you're a pediatrician. So when I bring my kids in, you're checking their weight, you're checking their, their vitals, and I think I've been in a new pediatrician, and she asked me actually with my 11-year-old, can you step out of the room? Now, I don't know if that was like, I'm going to see.
Oh no, you get kicked out starting at age 11.
Like, they kicked me out the room. And I said, who you think pays these premiums? But I was fine with it. But I thought to myself, like, trying to get them comfortable, right? To be able to trust. And so I left the room. But is that a time when you're able to say, look, I want you to be able to tell me the things that you may be uncomfortable with? Right. Or like my daughter will say, my mom's on her phone all the time, but that's probably her discomfort. But, is that the time when you're trying to connect so that they feel that they have an outlet?
Yes. So I need to back up because I have to say something about the spiritual, the prayer, and medicine. I'm sorry. So my other hat that I wear is I'm the executive pastor of a church here in Oakland. My husband is the senior pastor. So I have these conversations all the time with our members about when you're having mental health issues. Is it okay to just pray, to try to pray them away, or should you seek help? And the answer that I give is, if you have high blood pressure, do you just try to pray it away? No, you also take the medication that we prescribe. Or if you have diabetes, do you not take your insulin? Do you only just pray? No, you do not. You take the insulin and you pray. And so your brain is just another organ of your body. It's probably the most vital organ in your entire body. So take and treat your brain and mental health issues just like you do your kidneys, your heart, your lungs. If there was any other organ in your body that was not doing well and not feeling well, you would take the prescribed treatment and medication, and you would combine that with prayer. So that's what I'm going to say to you, ma'am, about any issues you're having. Pray, absolutely, but also seek the help that can help you, get you the tools that you can use to help in addition to prayer.
All right, I'm gonna do it. I was convinced long ago, well, maybe a couple of months ago, to do that.
Good.
So in terms of when you're talking though to kids,
yes,
how do you help parents kind of recognize, like when they come into you, is that whenever you or taking that time. I mean, it's a short period of time, but
Yeah.
I'm assuming you're trying to create the rapport so that you can look at any of the things and issues that are going on.
Right. It's a couple of reasons. Number one is you want to try to train your child about how to know what's going on with themselves so that they know what's going on, not just the mom or the dad, but that they can say, hey, I'm feeling a little weird. And they can start to have that, be able to have those types of conversations about their own health. So it's kind of about taking control of their own health, their own bodies, and really starting to see, well, what is that like? How do I express myself to my doctor? How do I advocate for something that I may want? So you're training your child each year when they come in for the physical. I started to kick you out at 11. At age 11, I'm like, Mom, love you, but I need some time with baby girl, baby boy by his or, him or herself. You got to go. And it's just training the child, but it's also sometimes, kids have questions that they're afraid and embarrassed to ask in front of their parents, right? A little boy doesn't want to talk about his developing and growing penis in front of his mama, so we got to get the moms and the dads out of the room so we can have those conversations and have real conversations about how your body is developing, what's normal and what's abnormal. Because again, just like Mr. Walker said, during this time, in early adolescence, you're saying, am I normal? So if I'm a little boy and I'm starting to have little wet dreams, but I can't talk to my pals about it because we're not at school together, I got to talk about it to my pediatrician, right? And little girls starting to develop breasts and starting to have hormonal shifts and changes. They don't want to talk about that stuff with their parents. So they have the opportunity to talk to someone else that they trust. And you hopefully trust your pediatrician so that that they're going to give good advice and good information. And we keep it confidential, right? That's the one other thing that I tell all of the kids that come in, like, listen, unless you tell me you're about to go out and kill yourself or somebody else, pretty much everything else that we talk about is going to stay in between me and you. You tell me you're experimenting with drugs. If it's not out of control, I'm going to have conversations with you to try to stop you. But I'm not going to go back and tell the parents absolutely everything that we discuss. Because again, we're building that relationship. We're trying to teach them responsibility. We're trying to teach them how to make good choices. And all of that happens, and believe it or not, in that little 15, 20 minutes that we might have with you and your child.
So, Jewel, how do you see this and how do you handle it? I mean, I know that we saw, and I think it was at the end of last year when the Miss America we woke up to the news and Miss America ended up jumping off of a building, which I'm thinking, oh my God, woman, you are beautiful. You are Miss America. You are like, everything is on top. I think she was a lawyer as well. It would just seem like everything was together. What are you seeing with students? Are you guys able to see signs? And is it around bullying? Is it around what are you able to see signs, and what can you guys do at the school level to be able to try to identify these things before they happen? If you can identify them.
Well, you know what, we're seeing it across the board. And so we're dealing with deaths by suicide, almost weekly. Whenever a child dies for any reason in Los Angeles County, it comes across my desk. And so we evaluate those. But more recently, we're seeing more of those deaths associated to suicide. And the horrible thing about it is that we're seeing it in younger youth. It's interesting because I see it as being twofold. One is, and this kind of builds on what Charles was sharing, is that, we have to really encourage parents to kind of know the signs, know some warning signs. And it's not real clinical. It's not anything real difficult. It's looking at, knowing my child's norm and why it has their behavior changed. When you start to see those breaks from the norm, when they stop eating the things they usually enjoy, or they're not sleeping, they're isolating, they're engaging in activities or stopping engaging in activities they once enjoyed. With younger youth, we usually see mood swings. We see some changes in grades and their behavior. On the more serious end, we see students giving away belongings and expressing feelings of, hopelessness. And so I think that, this was mentioned earlier, we also need to really teach youth about self-regulation And part of that is what we do in schools around social emotional learning. And that just is a simple thing of teaching them how to identify their emotions, and be able to verbalize it. Because sometimes younger youth, they don't know how to tell you I feel depressed. They're not going to say that. They're going to say I feel sad, or I don't know what's wrong. So we have to kind of teach them how to identify things and changes in their body and how they're feeling. But sometimes it's those simple things, we need to check in with our kids. Don't let the internet be the babysitter. Find out what's going on in their life. Find out what their interests are. We need to be able to communicate with kids at their level. Some youth may tell you they don't want to live. Take them seriously. And then you talked about bullying. Bullying is still a major issue in schools. And the problem is there was a time when bullying just happened on the playground or at school and you go home. Well, guess what? Now, because of social media, bullying is around the clock, 24 hours a day. So many youth are struggling. And I'm not saying that bullying causes suicide, because it doesn't. There has to be some other things at play. But can it add? Does it add to the risk factors? Yeah, it does. So with youth that might already have a mental health disorder, bullying can exacerbate some of the things they're going through. Do students have means? Do they have access to firearms? Do they have access to other weapons in the house? Those are all things that parents need to think about and begin to have those conversations.
So,
I'm sorry, can I just add to that? I just want to say the monitoring piece is so important, especially if you have, actually now any age, there's, PlayStations, Xboxes, YouTube, so many different things, that their cell phones, that kids can go into their rooms or in another part of the house and just isolate and spend hours upon hours on these devices. You have to know what your children are watching. So for parents, as a practical tip, at the end of the day or in the middle of the day, you need to take those devices and learn how to search history so that you can see what your children have been, what sites they've been visiting, what they're watching. So many of the younger kids in the very beginning of the pandemic who were committing suicide were learning how to commit suicide by watching YouTube videos. Now, if the parents were able to monitor and see that the child was watching YouTube videos on how to hang themselves or shoot themselves, then you would know, hey, I need to have a conversation. I need to take my kid in to get some help. So we have to monitor what our kids are doing. And that means, as parents, you can't let them be on the devices for hours upon hours and not know what they're watching. Spend some time and watch what they're watching. It might be crazy. You may not like it. You're not going to understand it. But if you show interest in it, my kids are into this anime. I don't even understand it. It's crazy.
You're talking about.
But I sit and I watch it with my son because he likes it. And I need to know, well, what messages are they giving to him on this show? Because even cartoons now are giving they're giving very dangerous messages and teaching things that I may not necessarily agree with in the value system in our house. So if you're watching with them, then you can address it right there on the spot, and you'll know exactly what your kids are doing. So you have to monitor your kids' devices.
I just feel like, no, I was just going to say, I feel like being a parent is when I grew up, there were 5 channels. So, I mean, it was like channel 13, channel 5, channel 4 and 7. And then channel 3 was public access. Now it's just exploded. And so, I mean, you're absolutely right. What they're putting into their psyche is having an effect. And this is kind of off the beaten path, and Charles, maybe you're going to answer this question, because this goes into like some of the policy realm stuff. What do we do? Because parents can't do it all. Parents can't, if you have multiple kids and you're working and you are working from home and you were, I was teaching 2nd grade and I was working. And my husband was working and he was helping to teach the 5th grader. And thank goodness we had an older one who was already in college. What do parents do I can't imagine my friends that had 3, like a kindergarten, a 2nd grader, a 4th grader. I can't imagine what they really were able to do during the 2 years of the pandemic. and not go crazy and not need them to say, look, I need to cook dinner, so I'm gonna let you be on the iPad. I need to rest. You go be on the iPhone and not bother them. Charles, what can we do? Because I think that what's happening is that Dr. Donna is right. Kids are getting so much subliminal things, even in our cartoons, and it's because the internet's really not regulated. So now we have everything underneath the sun, evil, not evil, whatever, all in one place and at a fingertip, but it's actually destroying society, I think. So, I mean, I just want your take on, and maybe I'm wrong, maybe I'm being a lazy parent, but I mean, what can parents do?
Good question. So I know this during the pandemic, well, I would have family time with the kids. Our big game was Monopoly. And it got heated. We were playing that Monopoly for hours, Monopoly Crenshaw, Monopoly Deluxe, Monopoly Black Panther. We were Frozen Monopoly. But it was something that all the kids liked because it teaches you about life, real estate, and how to make money as you get older, how to leverage your money and so forth.
How to hustle somebody.
How to hustle someone, will and deal, haggle. It's all, and I know not everyone's going to be into Monopoly. That's personal what we did in my household. Now, we were always into the things that our kids were in, that we're looking at. We put parental things on the PlayStation to limit what they could or could not play. And I'm gonna just tell one quick story. I mean, this is happening years ago. My dad told me. My dad's a retired LAPD detective. He once had an interview a kid that was like 14 years old. Just went to jail, or I guess YA, for murder. And my dad asked him, "Well, what made you do what you do? What made you do the act?" He says, "Honestly, I thought they would come back to life like they do in the movies in the video games."
Oh no.
And that's a real life story. Yes, it happened years ago.
Wow.
But my thing is this: even though that we're moving past the pandemic, even though there is a pandemic, it's the fact of the matter is this: we have a tendency to normalize things that should be traumatizing. Bullets, hearing gunshots, hearing bullets, getting in them fights, getting jumped, or just seeing like crimes being committed. We normalize it because it happens so often. So we tend to not, as Black, I always say that, Black Americans, brown Americans, we are one of the more resilient ethnicities on this planet. And we just kind of just move through it, navigate through it, instead of trying to find someone to kind of process what you experience. Because what happens is, this old saying that says, "Show me a child that's 7 years old and I can show you who that child is as an adult." Because a lot of behaviors that we experience as adults are because of things that happened in our childhood that were not processed or we didn't properly navigate through. So as parents, we have to be very present in the household. We have to now continue to put your kids in sports. Continue to know what their interests are. If your kid is really into guns, red flag, why is he into it? Find out the reasoning. There's, kids every time. Okay, so when I used to work at the children's psychiatric hospital, everyone used to come there, experiment with drugs and alcohol and drugs. I said, and we used to get in discussions about it. A lot of times they say they were doing drugs to escape traumas or escape things, or their parents weren't understanding. They weren't able to listen. They felt seen but not heard. And then a lot of times it's learned behaviors that all of the superficial cuts on the arms. They learn that from other kids.
Mhm.
So, I mean, we have to not only pay attention to what our kids are watching, but we got to pay attention to their bodies. We have to see what's on their arms, if they're why they're always wearing long sleeve shirts or sweatshirts in the summertime when it's 95 degrees.
Well,
What are they trying to hide?
Well, can I just say, I have an 11-year-old and she always does that, but I think it has something to do with the growing development. Her
Body image,
body.
yes,
And
yeah.
so I didn't realize, but so that's a cue. That's one of those things. I'm like, it's 95 degrees, get the sweatshirt off. But
Mhm.
it's a comfort thing. So
Yeah.
I agree with you. And so but I am wondering, what are some of the ways to help them deal with their emotions, meaning kids,
The kids.
stress or depression. And I'm thinking of activities like, volunteering, reading, or exercising, or I mean, or what's more practical, like coming out of a pandemic? What are some strategies?
You know what? It's all about finding a routine.
Yeah.
What were your children into before? Your Miss Jewel, Miss Forbes, she said, like, hey, one of the symptoms of depression is not having interest in the things that you used to love, enjoy doing. This is very true. Well, let's tap back into those sports or those activities. True growth happens when you become comfortable being uncomfortable. Let's try something new. A lot of kids are used to just same old thing: basketball, football, track, boxing, maybe. A lot of these kids have never been out the city. Let's try to take them out the city, explore. Maybe you haven't been out the city. Well, it could be a family trip, just to kind of let them know, like, hey, there's grass. Sometimes the grass is greener on the other side. There is more to life than just Compton or LA or Oakland or San Francisco. There's a whole another world out there.
So those are pretty
a lot
nice
of our
places.
parents may not be financially stable to do all those things, but hey, we can go to the parks. We can go to the Big Bear. Just take short trips.
Mm-hmm.
Well, and I was going to say that, and Dr. John, I want this to kind of go to you, because I think that, between you and Jewel to answer this kind of question, because, Charles, you're saying this, and I think that it's great, right? To go take a family trip. Gas is over $6 a gallon.
Oh yeah.
And so now we're dealing. So upon this, and this is not a dig on anybody in government, but the reality is, right? These communities that we're talking about don't have the same access. So going to football, going to soccer, all these things expensive, to buy cleats, to whatever. And so for people who are like, I think I was watching a news clip and it said that they were a woman who was talking about never having to go to a food pantry before, and that's where they are. So many of our kids are in this situation. They didn't ask to be brought into this situation, but they are there. And so Dr. Jewel, Dr. Jewel, see, there I go again. Dr. Donna,
Manifesting.
She is.
Dr. Donna, how are you seeing this play out? How are you seeing the rising costs? Are you seeing people not being able to come in? Like, do you have to go to clinics now to see people? Or do you have to open up your church to say, hey, guess what, guys? That you may not have paid your covered California premiums, but I'm going to do checkups anyway. Are you seeing that the cost of living right now is taxing our community so much that they are foregoing and how to navigate through, not just the pandemic, coming back into dealing with people, anxiety, and now financial pressures possibly in the household?
Yeah. So there's a lot that happened right around the pandemic. Is people lost jobs, right? And so you lost an income, or maybe even two incomes in the family. Thankfully, California is one of these great states where we expanded coverage for people who were low income. And so hopefully there are no children out there who are not covered by Medi-Cal, to be able to bring them in and get their physicals, get their shots, get their screenings for their eye exams and their hearing, and all of that should be covered for every child in the state of California. So if you're out there and your child does not have Medi-Cal, you should get it today. But there are definitely financial strains that were in our community even before the pandemic, right? And so as you're thinking about, well, what do we do now that we're in this time that maybe finances might be even more strained? There are a lot of free things that you can do. One of the things that, and it's not, I want to also say, it's not just for the kids in the household, but it's for us parents too. Because just like the kids are tied to their cell phones, parents, we're tied to our cell phones too. We're on scrolling through our social media channels, and we're telling the kids to go turn off their devices, and then we turn around and we still scrolling, and they're looking at you like, well, how come you get to still scroll and I got to turn my device off? So the family time is not just to benefit the kids, but it's also to benefit the parents, the adults in the household, because everybody needs a break from the screen. And so some of the things that you can do that are free, and you can using the devices. So, we did dance offs, right? I'm a 90s hip hop. That's my era. Like, I'm an out dance you, I have Roger Rabbit. I'm gonna do all snap a snake. I'm gonna do all that on you, right? And so my kids, we learned TikTok dances. So I learned their dances. I taught them my dances, and we would dance. And that's movement. So that's some physical activity. That's family time. That's fun. And it's free. So it costs you nothing. You already have the device. You have, if you have cable already or internet, there's a number of free sort of movement and exercise routines that are on Xfinity, for example. They have a whole wide range of different exercise activities that you can do in your household for free. You can buy a jump rope for $2.99 and go outside and jump rope. And you can teach your kids how to double dutch. You can teach them, you can do, I'm telling you, I'm old school. We were like, hey, y'all gonna learn how to play jacks. You're gonna learn how to double dutch. You're gonna learn how to do some dances and get some movement like you used to do when we were kids. We didn't have all of this stuff, right? Your parents told you to get outside and don't come back in. So you had to make some games up sometimes because you were so tired of playing the same games. Get your kids' creative juices flowing. Find a park that is safe that your kids can go to. Go in your backyard, walk up and down the street, walk around the block for 30 minutes, but do it together. There's a lot of free activities. So don't let the fact that you can't afford to buy, to participate in a football league or a basketball league be the reason why your kids are not getting any activity. Activity frees up your mind, causes your endorphins to get running up, which increases your happiness, decreases stress for your parents, older kids, anxiety, depression. All of that is helped by movement. And so I say not exercise, but movement. Figure out some way to get some movement in your life and in your children's lives. Doesn't have to cost a lot. It can be absolutely free 99, and you can have a whole lot of activities to do with the parents and the kids. The other thing I want to say is for parents is to cut yourself some slack, right? You have a lot on your plate. And I found during the pandemic, I have two kids. One was, in second grade, one was in 8th grade. And we were trying to figure out, my husband and I, we were both working, I was doing 24-hour hospital shifts. So I was trying to figure out how to come home, make food, talk to the kids, and do all of these things. And I was driving myself. I was causing more stress because I was attempting to be perfect in my parenting. And I finally had to say, you know what? It's okay if your kids have hot dogs for dinner tonight. They're going to survive. Matter of fact, they're going to love you because you're not making them eat vegetables. So you got to cut yourself some slack and be realistic. Today, some weeks, honestly, I said, little second grader, you're not learning anything this week, okay? Because I can't do it. This is a big week for the 8th grader, and we're going to have to get her through her testing today. Read this book, do this one little worksheet, and I'll get back with you over the weekend. And you just have to learn how to cut yourself some slack. We are not perfect. We do not have unending energy. We have our own stressors with our jobs and relationships and managing everybody in the household. You've got to cut yourself some slack and get some time in so that you can do some of the things that you enjoy doing and get some movement in your lives too, parents. Okay.
Well, you make me feel so much better. I don't feel like a total loser parent, but
That's
Jewel,
right.
since you see kids all the time, what are some of the ways that maybe even the school district is dealing with, the kids that they see have come back into the classroom and acting out?
Mhm.
What are some of their, what are some of the ways or strategies that you guys have employed to, help them with emotions and stress and depression?
That's a good question, because there was so much that was happening from the beginning of the pandemic, but especially when students returned to in-person learning. Schools incorporated so many different activities. They were doing mindfulness activities. You saw schools doing yoga. They were doing play days and just building activities in everything the students were doing. Back to what Dr. Donna said about, it's about reducing screen time. And I think schools do a good job of that. I'm not sure we do a good job as parents all the time, but we have to be mindful that if we want students or youth to do something, we got to do it first. We have to model it, right? So I can't tell my child to get off their phone and I'm on my phone. So it's about shutting down, screen time, coming together, talking, doing activities together. I heard you guys talking about bicycling and taking walks. All those things have to happen. Schools partner with a lot of different social media outlets to kind of build activities. Like there was a site called Go Noodle, and it was wonderful for younger kids. It had all these activities to do. Some of them were art activities, some of them were exercise activities, and parents could go on and download things for free. Thousands of activities during the pandemic to get their kids moving, get them thinking, get the juices flowing. It really is. It just takes a little bit of work on our part as parents, but also engaging with students where they are. It's interesting when you were talking about the jump rope for $2.99. I was in the Dollar Tree and they had yoga cards for kids for $1.25. So simple things to help them do yoga poses, but it also linked different emotional things to it, like hope and peace and happiness. And so we have to kind of embed those things in our everyday life. And it's going to take a while. This isn't going to happen overnight. We think we need to do things to help regulate. And then at the same time, we need to help children de-escalate themselves. And that can be done through doing, meditation, prayer, mindfulness, yoga, all those different things. But kids don't play in the same way that we probably played. And so we have to find outlets for them. We have to incorporate play into everything that they do. Even if it's learning, they can do both at the same time. Why not?
Right.
That's not how they used to treat us. I remember, just like I think Charles said, that the teacher was like, I'm only required to do this. I'll never forget a 5th grade teacher of mine said, you guys could sit here. I think we were goofing off, and she was like, I get paid whether you learn this information or not. And I was like, wow. And that's so deep, whenever I didn't think about it whenever I was that age, but it's something that stuck with me.
Yeah.
And whenever I look at my challenges around fractions, sometimes I'm like, oh, she still got paid and I didn't learn. So
that's right.
My bad is on me. I'm learning now with my 5th grader and my soon to be 4th grader.
You know what? One of the biggest things that I've learned during all of this, and I say it all the time, we need to give space and grace.
Yep.
Because students have experienced something they've never gone through in their lives. We're experiencing something we've never gone through in our lives. There's no playbook for this. We are learning to navigate this system as we go. And the pandemic has brought a lot of things to the forefront, especially some of the gaps in our communities. But we really have to not expect ourselves to be perfect, not expect children to be perfect. They're going to be just fine. They're resilient.
That's right.
If nothing else, they are resilient and they are survivors.
And so, Jewel, and I know that you kind of already touched upon this, so it's a 2-part question. So did you see a difference in behavior of kids when they were coming back to in-person learning? And are they reluctant or excited to return to pre-pandemic activities?
we saw both. You saw it across the board. So you saw some youth, because, you think about, for certain groups of youth, social, interaction is everything, right? So you saw them, they couldn't wait to get back to their friends. But then you saw others that were very hesitant. They were scared. And especially among youth that had lost a parent or lost both parents to COVID, they were very scared to come back and hesitant. And then we had some youth, they were scared because if they would come to school, they were scared their parent was gonna die or get sick or something while they were gone, because they had been caretakers for their parents or their grandparents or others. So you just saw different things across the board. I think they're starting to lean into more of a norm now. When schools first opened back up, there was still a huge attendance issue. Youth were not returning on a normal basis. But now that I think they're getting in the swing of things, they're enjoying each other. They're realizing that they miss their friends and the interactions and even their teachers and the staff at the school. So I guess it just really depends on what's going on with that student's life.
Okay. That's always like one of those things that I'm just wondering, like, do they want to come back? I know I was actually, I loved actually the pandemic, but I realized the damage it was probably doing on my kids and needing
Exactly.
emotional. So
Mhm.
I enjoyed it. I enjoyed that I had to go nowhere, and I enjoyed
Yeah,
that.
yep.
Today I am fully dressed. This is a dress that I have on, but I love the fact that I could fake the funk. This was not, I was dressed up to here.
Yes.
So, but with everything else that parents worry about, should they be worried about long COVID or long-term negative effects on them as they mature? My family just had a bout with COVID, unfortunately.
Mhm,
And
Mhm.
brother-in-law brought it home. The children got it. My husband got it. I didn't get it though.
Mhm.
I think it was a joke. I said God wanted to make sure that somebody was there to take care of everybody.
Exactly,
So,
Yeah.
so, you know, should we be worried? I mean, Jewel, what you said, I was worried.
Yeah.
I'm being a kind of partial caretaker for my parents. My
Mhm.
parents are older. And so there is a fear. I don't bring my kids over, even though my mom wants to see them. I don't bring them over because I'm scared
Exactly.
that- I know
Exactly.
they will be able to be okay with it. I don't think she will
But
be
your parent,
okay with it.
exactly.
My dad would be okay with it. So, what should parents be worried about?
I always say, don't worry, but be diligent.
Mhm.
And be diligent in not only recognizing the signs of long COVID, whether that's physical or whether that's mental. And then, one of the things we have to encourage parents to do, know where to go to get help.
That's right.
We have no shortages of resources here in Los Angeles County. But what we do have is a lack of communication and how to get the word out. So we have to make sure that we're sharing resources, just like what we're doing today. Youth continue to amaze me. They're so resilient. So we just need to take those opportunities to engage, find out what their needs are, link them with the right resources. I think schools are a perfect place to do that. They serve as hubs, to really help students, not only for mental health, but we have school-based clinics that provide physical health. No child, and I think Dr. D was talking about that, no child should not have access to health services, whether it's mental health or physical. All those things are available. One of the initiatives we've been working on is the Community Schools Initiative, which creates a hub in every way for students with partners throughout the county. So that's one way we're addressing that. And so no child should go with their needs unmet.
And you should have a healthy respect for COVID. One of the things that when it first came, and we had this myth that children did not get COVID, right?
Mhm.
Everyone said it's only the older folks that are going to get COVID and die from COVID. Well, of course, as it continued on, we realized that that was not true. We've had, unfortunately, deaths all the way down to newborns because of this disease. So you want a healthy respect for it, just like swimming and water, right? You want a healthy respect for water. And so there are things that you definitely want to do to protect yourself, wearing the mask, like I talked about in the beginning, making sure that you are vaccinated. We have vaccines for kids ages 5 and up. So you want to make sure that everyone gets vaccinated that's possibly can. If you have not had your booster shot and it's been more than 4 months since you've had your primary series, you should have a booster shot. So you want to protect, you want to stack everything you can on the protection side of things so that you don't get COVID, right? But we know that all of those things may not prevent you from getting COVID, but if you do get it, you're going to have a much less reaction than if you were not vaccinated, than if you are vaccinated. So you want to do those protection things. But we don't really know the answer to that long COVID question because it's been too soon. We don't have long-term studies. We know that that's the fear. We know on average about 10 to 30% of people who get COVID are going to have long COVID symptoms, which means they are going to have some residual symptoms 4 weeks, 6 weeks, 6 months after being diagnosed. We know that those symptoms range from things like headaches to persistent vomiting and diarrhea to memory loss, to, having difficulty in men, having, erections, to increasing the risk of diabetes. There's a ton of different things around long COVID. So you need to, number one, pay attention to your bodies and pay attention to your children. If they're telling you that if they've had COVID and they're telling you that they're having headaches still, or they're having difficulty focusing, they may not be able to describe a headache. My son had never had a headache. And he said, "Mom, I have pain behind my eyebrows." And I was sitting there going, "What, pain behind your eyebrows?" And then I realized he was telling me that he was having a headache, but he never had the headache, so he didn't have the word for it. So pay attention to when your children are telling you things that they may not have the correct name, but you can identify it as something that's not right and take them in to be able to see their doctor. I also want to just say that when we're thinking about our kids and caregivers, we have to think about all those kids who've lost caregivers, right? There's over 300,000 kids in the United States who have lost caregivers. They've lost a mother, a father, grandparents, a guardian, whomever was in charge of taking care of them. What are we going to do as a society, right? As the communities to support those kids that are dealing with everything that we've talked about around COVID, plus the loss of their loved one who was taking care of them. So as we're moving back into this, being normal and trying to get our kids back to school, we have to, as a community, as a regular community, faith-based community, we have to think about those kids that are out there, embrace them, bring them into our circles so that we can continue to give them love and support. So I just want to encourage everyone to pay attention to the kids around your community. If they seem like they're just, no one's paying attention to them, no one's caring for them, you might want to inquire, and maybe that's something that you can do.
Well, like all good things, I hate that this conversation is going to come to an end, but I have one more question, and I'll have everybody just answer this question. Starting with you, Charles, what can parents do to provide meaningful and consistent support?
One of the first things that they should do is remain present. I keep saying remain present, meaning be there. Ask your kids about their interests. Ask them what's going on. Ask them how their day at school is. Sometimes parents don't come home and won't ask their kids anything, and just remain proactive when it comes to what you may, even if you have a hunch that something may be wrong, seek help. My thing is a lot of parents really need to be psychoeducated on mental health. Mm-hmm. There's still a big stigma around mental health, seeing therapists and so forth. And then I think Dr. Donald or Ms. Forbes, I think one of them said something about respecting COVID. How about let's start with the conspiracy theories. Let's stop that. I feel like we're sometimes are miseducating our kids based on what we may have heard on YouTube. What these guys are talking about, just what happened in Tuskegee and so forth. No, let's pay attention to them. Let's listen to science.
Yeah.
And Miss Jewel, what could
Ooh,
parents do to be
just-
meaningful and consistent support?
So just building off of what Charles just shared, we need to find ways to incorporate more communication. That's one of the main things that we can do. But check in, just simple thing, just check in. You know, in schools with counseling, we always say check in, check out, but just checking in, you know, asking them about their feelings. You know, how many times do we forget to ask them about their feelings? They're people as well. And, you know, if they're mentioning something like self-harm or hurting themselves, know where to reach out for help. But mostly I would say be empathetic and supportive. And so for sometimes, you know, for many parents, this might be a challenge, but there's resources. There's NAMI for parents out there where they can learn about mental health and how to identify those issues. And so, but I really believe it really starts with maybe finding other support systems with other parents. If you are afraid to have these dialogues, identify a parent that you can talk to and that can kind of help you in the process. Find ways to just, you know, talk to your child and support them and be knowledgeable about their interests. And I know we've said that over and over. But most of all, let them know you care and what they say matters, what they're feeling matters.
Great. Dr. Donna, we're going to end with you. What
I will say, bite your tongue and open your ears. When you're talking to your kids, listen. Don't immediately jump in because you think you know what they're going to say. Don't immediately go into solving the problem for them. Don't immediately chastise them because they may be telling you something that you don't want them to do, or they may be expressing something that you may not like. So bite your tongue, just listen, open up your ears and hear what they want to say, because you will get a lot of information if you just shut up and let them talk. And then the second thing I'll say is, don't be afraid to ask the question. So if you see that your child is struggling, don't be afraid to ask. Ask. If you think that your child is thinking about harming themselves, don't be afraid to ask. And you asking is not going to lead them to doing the action, but it really could prevent it from happening. If you say, are you thinking about hurting yourself? Are you thinking about killing yourself? And they're going to tell you. And then you can seek the help and get the help that they need.
I'm sorry, last thing. Please do not assume that kids are acting out because they want attention.
Yeah.
A lot of kids they express themselves by acting out because there's something going on in their life that you or may not be privy to knowing. Pay attention to those signs. And like Dr. Don says, ask questions. You know, you'll be surprised. Kids will be blunt with you. They'll let you know. But just don't assume like, oh, they're just acting out because they're looking for attention. Nah.
Well, Dr. Donna, Charles, Jewel, I want to thank you for joining our panel and bringing to light this important conversation. I appreciate your knowledge, your time, your candidness. I, for one, feel like I went to church and therapy all in one, and I'm going to take back your things that you said. Like Dr. Donna, you hit the nail on the head. I do it all the time. I will jump in and solve my kid's problem, and I have to stop. That is just, I don't know what that's in me, but I have to stop. So
it's the mother in you. It's the mother in you.
And I have to stop. So I also want to thank those who took the time to listen to this panel. As you carry on, we encourage that you remain safe and healthy during the pandemic, because even though death rates have dropped, many in our communities are still contracting COVID-19 variants. Remember that vaccines are how we get through the pandemic, so please get fully vaccinated and boosted. Get tested if exposed to the virus, or if you have symptoms or traveling, and stay at home when you're sick. I want to say be safe and be well, and thank everyone for joining us.
Thank you
So much.
Thank you.